Welcome to the Getting Healthier Together module on high blood sugar. This video can help you understand what high blood sugar is, learn about the relationships between high blood sugar, prediabetes, and diabetes, find ways to prevent or control high blood sugar, and create an action plan for yourself. What is high blood sugar? High blood sugar, which is also called high blood glucose, is a condition in which a person's blood sugar level is higher than normal, but not high enough to be called type 2 diabetes. High blood sugar is often known as prediabetes. That's a stage that often happens before diabetes, but even at that stage, the long-term damage of diabetes may already be starting. Diabetes is a chronic disease that has no cure. Diabetes occurs when the body can't produce or use insulin effectively. When this happens, a person's blood sugar level is much higher than normal. There are some risk factors for developing diabetes, starting with family history. If you have a blood relative who has diabetes, your risk for developing it is significantly increased. Another factor is race or ethnic background. People of African, Asian, Hispanic, and Native American descent have a greater risk of developing diabetes. How about weight? Here's a question for you. Do you suppose a person's weight can put them at more risk for developing diabetes? If you answered yes, you're right. Being overweight is a risk factor. A person who is 20% or more over their healthy body weight has a higher risk of developing diabetes. Hypertension, which is also known as high blood pressure, increases your risk for diabetes. Age is a factor too. The older you are, the higher your risk. Drinking too much alcohol over time also increases your risk. Here's one more question for you. Does smoking tobacco have anything to do with increasing the risk for developing diabetes? The answer to this question is yes. A person who smokes is more likely to develop diabetes than a non-smoker. A final risk factor is having a history of gestational diabetes. A woman who developed diabetes during pregnancy or delivers a baby over 9 pounds has an increased risk. When you know what the risk factors for high blood sugar are, you're in a better position to take steps to control your sugar levels so you can help prevent other health problems like diabetes, heart disease, and stroke. In Part 2, we'll be talking about the difference between high blood sugar, or prediabetes, and diabetes. How are high blood sugar, or prediabetes, and diabetes different? It's common for people not to know they have high blood sugar or prediabetes because there aren't any symptoms. Prediabetes can only be diagnosed when a healthcare provider uses a blood test. While prediabetes doesn't typically cause any symptoms, diabetes does cause symptoms. The symptoms of diabetes include increased thirst, the need to urinate, blurred vision, a feeling of being tired most of the time for no obvious reason, and extreme hunger. Besides looking at symptoms, the most accurate way to find out if a person has a high blood sugar condition is by testing the blood. There are 2 different blood tests that can help diagnose prediabetes. The simplest test is a fasting plasma glucose test, also called an FPG test. This test must be done on an empty stomach, which means not eating or drinking anything except for water for at least 8 hours before the test. A fasting blood glucose less than 100 milligram per deciliter is considered normal. A person with high blood glucose or prediabetes has a fasting blood glucose level from 100 to 125 milligram per deciliter. A fasting blood glucose of 126 milligram per deciliter or greater is considered to be diabetes. The second blood test that can help diagnose prediabetes is called the Oral Glucose Tolerance Test, or the OGTT. The test measures how the body handles a standard amount of sugar or glucose that is given to the person to drink. It measures the amount of glucose in a person's plasma before and 2 hours after drinking a large, pre-measured beverage containing glucose. A healthcare provider can then compare the before and after glucose levels to see how well the person's body processed the sugar. A person with prediabetes will have a blood glucose level between 140 and 199 milligram per deciliter 2 hours after having the pre-measured drink. Normal blood glucose levels after the OGTT will be less than 140 milligram per deciliter. Blood glucose levels that are 200 milligram per deciliter or higher are considered to be diabetes. If you're a person with one or more risk factors for high blood sugar, you'll be glad to hear that there are several things you can do to control your blood sugar level. First on the list is being physically active with a goal of exercising at least 30 minutes most days of the week. Or you can do 2 15-minute exercise sessions on most days of the week. If you're overweight, try to lose the extra weight. A good goal is to try to lose around 5 to 7% of your body weight, which would be around 10 pounds for a 200-pound person. If you're a smoker, stop smoking because smoking can aggravate many problems that people with diabetes already have, such as heart and blood vessel disease. Eat healthy by eating fiber-rich fruits and vegetables every day, choosing whole grain foods, and cutting down on fatty and fried foods. So, does this mean that to control high blood sugar you can't have foods you enjoy anymore? For example, say you love ice cream. Do you have to stop eating it forever in order to be healthy? Yes or no? We'll come back to this question in a moment. Limit the amount of alcohol you drink to up to 1 drink a day for women and 2 drinks a day for men. And if your healthcare provider has asked you to take medicine, follow the instructions in your prescriptions carefully. The medicine can only do its job if you do your part and take the medicine as prescribed. Coming back to our question about eating ice cream, did you answer no? If so, you're right. You can still have foods you enjoy. You can do this by eating smaller servings of special treats as you keep following a healthy eating plan most of the time to help avoid complications. People with high blood sugar or prediabetes are more at risk for developing diabetes, heart disease, and strokes. With diabetes, the risk for other complications such as kidney disease, nerve, and vision problems are also increased. Some of these problems may already be starting with high blood sugar, which gives us all the more reason to start taking steps to prevent the problems early. In Part 3, we'll be talking about ways to prevent or control high blood sugar. Prevention and control are the keys to keeping blood sugar at a healthy level. Our healthcare professionals, like our doctors, nurses, pharmacists, technicians, have a great deal of knowledge and experience when it comes to understanding and treating all the conditions that can come with high blood sugar. They can give us the best information and advice in the world, but when it comes to taking action, there's only one person who can do the real work of keeping blood sugar at the healthiest level possible. That job belongs to us. But luckily, we don't have to do the job alone. The job of preventing or controlling high blood sugar starts with getting the facts so you can make the best plan for yourself. There are 5 questions you can ask your healthcare provider at your next visit. They are, is my blood sugar normal or high? What is my blood sugar number? What should my weight be? What things can I do to help lower my blood sugar? The last question to ask is it safe for me to start regular exercise? And here's a question for you. What do you think is a good way to remember these questions and to keep track of your healthcare provider's answers? For many people, asking the healthcare provider a lot of questions and then remembering all of the answers afterward can be pretty hard. If you like, pause this video for a bit so you can think about how you might do this. Continue playing the video when you've had a few moments to think. Did you think of writing down the questions before your appointment? You could write each question on a separate index card and then ask your healthcare provider to write the answer in the empty space. Or you could use regular lined paper and leave room between each question to write your healthcare provider's answers. If you write the answers yourself, it would be a great idea to ask your healthcare provider to double check that what you wrote is correct. However you choose to get the information you need, do let your healthcare provider know that you want to work together to help lower your blood sugar as needed. Your healthcare provider can work with you to come up with an action plan based on your personal situation. When you follow an action plan that you and your healthcare provider design especially for you, you can help control high blood sugar levels to help prevent other health problems like diabetes. In Part 4, we'll share an action plan that you can use as a starting place. An action plan is like a roadmap. It turns the decisions you make about what you want for yourself into practical steps for getting where you want to go. There's an action plan for high blood sugar handout that's available to you, and it looks like this. You begin using the plan by reading through each of the choices to see which ones might interest you most. The choices on the high blood sugar action plan are organized into sections including watch your weight, take your medicines, get moving each day, make a meal plan that works, and check your blood sugar. The idea is to choose the action items that you want to do. You can also write in your own goals in the other section of the handout. You may be tempted to check off a lot of the boxes in the list, but it's better to start off with just one or two. Lifestyle changes are made one step at a time. If you're overwhelmed with too many changes at once, you're less likely to reach your goals. You can always add more goals later as you continue making changes that move you towards the better and healthier life you want. When you're finished making your choice, there are 4 questions for you to ask yourself based on what you selected. You've already answered the first question, which is, what behavior would I like to change, based on which checkboxes you've selected. This second question to ask yourself is whether you believe that it's possible for you to do the things you've selected. Answer with a yes or no. The third question to ask yourself is, what must I do to achieve this change? Make sure that you identify a specific action that goes with what you want to change. For example, if you choose that you want to take a walk most days of the week, decide which days you'll walk, when you'll walk, and where you'll walk. Write your method for measuring whether you've reached your goal in the space provided on the action plan. Deciding how you'll measure your success is a very important part of this process. The fourth question is, when will I make these changes? Think about how long you think it'll take you to make this change in your life, then write the date for when that'll be in the space provided. The last step for creating your personalized action plan is to select your confidence level for making the change you've decided to make. To do this, select a number from 1 to 10 for how confident you feel that you'll follow your action plan. A confidence level of 10 would be the most confident, and a 1 would be the least confident. If your level of confidence is lower than 7, think about choosing something else on the action plan, or maybe giving yourself a little more time to make the change. There's one final handout that's available to you, and it's called High Blood Sugar, What You Need to Know. The handout has a summary of the key points from this video, and we hope it'll be useful to you. Thank you for your time and for participating in Getting Healthier Together.